peri-implant tissues. After the implant has been placed, all the tissues around the tooth implant has to be preserved. Okay, so this particular topic also will comes under periodontics. And to maintain and improve the periodontal peri-implant health, comfort, aesthetics, and function. Okay, so this is the overall goal of the periodontics. Okay. What do we do in periodontics? Okay, so we mainly used to treat the periodontal disease. See, this is a severe case of gingivitis. Gingivitis means nothing but inflammation of the gingiva. Itis translate to inflamed. Okay, so anything which ending with itis means inflammation is present. So here you can clearly observe the amount of inflammation which is present. Okay, so after a basic simple hand scaling, okay, there is no other instruments were used, only basic hands. After using basic hand scaling, you can clearly see the reduction of all the inflammatory findings. Still some amount of inflammation is still there in the marginal tissue, but it has to be again another round of scaling, and it also shows the patient's maintenance. Again, the maintenance of the patient is getting poor. Okay, so not only the treatment, you have to tell the maintenance aspect also to the patient. You have to clearly tell how to maintain these interdental spaces where the brushes won't reach. You have to tell which type of toothbrushing technique this particular patient has to use. Okay, so all those things will come under your periodontics. So see here also, see, you can clearly see the amount of inflammation here and amount of deposits here. And clearly post-operatively, you can clearly see there is all these inflammatory findings have been reduced. Okay. And you can also treat all the aberrations of the gingiva. Okay, aberrations of gingiva means any growths or any other sort of structures which are going on the gingiva can be treated in periodontics. Okay, so see here you have seen a pyogenic granuloma like mass. Okay, so this is usually due to, this is termed as a irritational fibroma. Okay, so this fibroma has been removed surgically, and this is the post-operative picture. You can clearly see the complete resolution of the this thing. And see this another picture where there is severe gingival enlargement is there. Okay, so you see here we are removing the excising the gingiva. So this is the post-operative view. You can clearly see the gingiva has been shrunk and it is neatly closely adapting to the structures of the tooth. Okay, so all these treatments comes under your periodontics. Even the removal of frenums. Okay, removal of frenums can also be performed in our department. So removal of tongue tie, removal of the your. You can use, this is a laser assisted frenectomy. So you can clearly see the bloodless field here. Okay, it has been severed with the help of a laser, and here it has been removed with the help of a surgical incisions. Another one procedures are root coverage procedures. Okay, so see, you can clearly see the recessions which are present in this particular teeth. Okay, so this is the normal CEJ, and the yellowish part you are seeing here is the root surface. So root surface has been exposed in this particular teeth. So what we can do is we can cover the root surface. See here in this particular tooth you cannot see the root surface. Okay, so this procedure is termed as root coverage procedure. Okay, whatever the root which has been exposed due to the periodontal disease can be recovered with the help of a surgical procedure. And this is an aesthetic procedure. Okay, you can clearly see the dark pigmented gums here. Okay, and when the patient smiles, this particular gums are visible. So in these cases, what you can do is